before a baby's birth, expectant moms deal with a lot of changes, but exercise routines do not have to be one of them.
It's absolutely safe for women to exercise during pregnancy. This is something that's really great for mom and for the baby and for great pregnancy outcomes. Anybody who's pregnant who wants to exercise should check with their doctor first. There are some conditions that women have during pregnancy that does not allow for exercise activity.
Andrea Pachetti is an avid exerciser.
I definitely knew I wanted to continue exercising, but I just wanted to make sure that it was safe for me and safe for the baby. When I first went to the doctor, I had a conversation with her about the type of exercise I had done beforehand and what I hoped to continue throughout the pregnancy. So it was a good back and forth about what would be good limits for me on my exercising and what would be safe for the baby.
For Pachetti, that meant being able to run up until around the 8-month mark. At that point, she tweaked her regular routine a little.
I kind of switched over to doing more things in the gym, doing ellipticals and spinning and some free weights.
Some activities are not supported during pregnancy, and by that I mean things like soccer, which of course could cause impact. Activities which could cause you to be off balance as you get larger in your pregnancy, later in your pregnancy, like riding a bike might not be so great. So it really depends on the type of activity that mom was used to before, how much she was exercising before.
Exercise may not be advisable for pregnant women with asthma, heart disease, or diabetes. Additionally, exercise may also be harmful for women who have experienced bleeding or spotting, a low placenta, threatened or recurrent miscarriage, previous premature births, a history of early labor, or women with a weak cervix. Also important, knowing when to stop.
If she's short of breath, that means that the baby's not getting enough oxygen, and if she's feeling any chest pain or any discomfort, that means that her baby is also not going to be doing as well.
Hydration is also important when exercising while pregnant.
I was very cognizant of always taking water with me to my workouts and making sure I was drinking enough afterward and eating enough afterward, because you do have to eat extra calories when you're working out if you're pregnant. I have read things that if you are in shape, that it does help your delivery, because when you're preparing for delivery, I've heard it be equated to running a marathon, and you're training your body, and the more muscles and stamina that you have, the better. So hopefully that's the case. That's what I'm hoping, at least.
It lifts your mood, it cuts down on fatigue, it helps even give shorter labor periods, it helps with aches and pains.
For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.